Dr. Bienzle is a researcher at the Ontario Veterinary College, and today she's going to discuss new research investigating the use of stem cells to treat equine asthma. Welcome, Dr. Bienzle, and thank you for joining us.
Thank you, Jackie. My pleasure.
Dr. Bienzle has a long history of collaborative work searching for solutions to the common issue of heaves in horses. I understand some of your most recent research has been working with horses diagnosed with severe equine asthma utilizing stem cell therapy. But before we discuss this new research, can you tell us a little bit about how horses develop this irreversible disease and the importance of prevention?
Sure, and Jackie, as I think many of the people who will listen to this know, heaves, as is the old and correct descriptive term for this disease in horses, and we now more frequently call it severe equine asthma, is a common disease of horses that are long-lived and are stabled and fed hay for part of the year. It's a disease associated with exposure to molds and dusts in the air, usually associated with hay, can also be associated in some instances with grass, very moldy grass in humid climates. And the bedding plays a role as well if the bedding is very dusty. And horses get sensitized to these components in the inhaled air. And with time, it is not apparent to us initially that they have been sensitized, but with time they develop airway inflammation, and that manifests with coughing, occasional coughing, a runny nose. And as they are continue to be exposed to the same dusty air, it keeps getting worse, and eventually the animal is coughing more continuously, the nose may be running, and then something happens inside the lung where there is thickening of the bronchial wall. There is extra smooth muscle that is being laid down because it becomes hard for the horse to exhale against mucus and inflammatory cells in the lumen of the airway. And so then they develop in the later stages of disease what's called a heaves line, and that is really just hypertrophic abdominal muscles that assist with exhaling air. And so the disease heaves, as we know it, is by the time we diagnose it, it usually has already been there for quite a while, if not several years, at least a few years, and it is difficult to entirely reverse it. We can treat the symptoms reasonably well with immunosuppression, but we cannot reverse the disease, and the vast majority of horses are unable to perform as athletic horses, as a show horse or as a jumper or even as a companion horse with a little bit more strenuous riding. And so it's, in that sense, it's an incurable disease for the most purposes. It's somewhat treatable, but not curable. Because as I just discussed, it's really a very difficult to treat disease, and to prevent it is the way we need to go. And clean air is the key to prevention. And that's hard to manage in many areas when the horses have to be sheltered from cold and wet in the winter, and they need to be indoors. And we also don't want them to be having a really thick hair coat. So anytime we make them exercise a little bit, they sweat like crazy. So we do need to keep them in conditions where their hair coat is not too thick. We can still exercise them a little bit year round, but we want good air quality, high quality hay. Definitely not avoiding hay that is being exposed to rain. The big bales that get rained on are terrible for horses. So prevention by exposure to clean air, clean hay is key.
So tell us about the new regenerative therapies like stem cells that are under investigation to treat horses for equine asthma.
So stem cells are a very heterogeneous concept, or heterogeneous cells. Stem cells can be tissue specific. They could be lung stem cells. They could be what are called multipotential stem cells that have the ability to give rise to epithelial cells and stromal cells that form supportive tissues in the body. And they can also be what I call sometimes totipotential cells that are derived from the bone marrow, and they can, do almost anything. They can reconstitute virtually any tissue. And stem cells have been an attractive therapy for many conditions, and not necessarily to replace existing disease tissue, but they are used mainly in the sense of trying to change an inflammatory condition, because the stem cells have putatively what are called immunomodulatory properties, in that they can downregulate chronic inflammatory conditions. And so that's the underlying concept for trying to treat asthma, which is a chronic inflammatory condition that is incurable, to treat it with stem cells from the animal itself that are derived from, in this case, we derived it from subcutaneous fat tissue and differentiated them in vitro and then injected them into the lung, but we'll come to that in a moment. And so that's the concept, is that these cells that are being put at the site of inflammation, that they will change the inflammatory milieu there and then reduce inflammation in the long term. The one attractive aspect about stem cells is that they have no side effect per se, as many drugs would do. The alternative for treatment, a standard of therapy for horses with asthma, is inhaled or sometimes systemic corticosteroids. Corticosteroids have a lot of side effects. If they're inhaled, we can use a much lower dose and the side effects are much smaller, but they still have side effects. And so that's an attractive aspect of using a cellular therapy or biotherapy, in that the side effects are minimal.
What's the delivery method under development for using stem cells to treat equine asthma?
Yeah, that's a good question, Jackie. Asthma is really a lung disease. There is evidence of systemic inflammation, in that the whole body has some evidence of inflammation. You have increased inflammatory proteins in the blood, but we don't see evidence of organ-specific inflammation outside of the lung. Like horses with asthma rarely have dermatitis or colitis or another inflammatory condition. So stem cells in this case were administered directly into the lung, which is attractive because that is where the source of the inflammation is, and that's where the disease happens. And horses are big. We have developed very good methods for examining the airway, for putting endoscopes low down in the airway, and so we can administer stem cells in that location. That's an attractive component, as opposed to giving it intravenously, where we don't really know where they end up. They might go to the spleen, and we don't know whether that is effective, if they end up in the spleen or not.
What were the challenges of this study?
Deriving stem cells is an art and a science, and this study, as you can see from the publication, was performed in Slovenia with my colleague Modest Vengast as a senior author, and he collaborated with an expert group at the University of Slovenia who have long-standing expertise in growing stem cells from a variety of animals and people, and so they have established protocols for that. And so they are very successful at doing this, but this is not for the casual investigator, because it takes experience to have the right culture conditions to make sure those cells are clean, that they're not cultured for very long, and that when the final preparation is administered to an animal, that it is free of cell culture components that could make inflammation worse. So it's technically challenging, and there are individual research laboratories that have established expertise in that field.
And what have the results of the study yielded so far?
So this study was of an interesting design. It involved horses that had a series of horses. They were all older, as is typical of horses with asthma. And so they all had asthma. That was confirmed by standard diagnostic tests, by endoscopy, by bronchoalveolar lavage, and by challenge with moldy hay. So they all developed exacerbated asthma. And then the group was divided into two, and one group was treated with adipose or fat tissue-derived stem cells by intrabronchial injection, and the other group was treated with corticosteroids orally administered, so systemically, which is the standard of therapy. And the investigators were blinded, so all investigators that looked at research data from these horses were blinded as to who has received which treatment. after 3 weeks of glucocorticoids therapy or after administration of stem cells. And the lung scores were reevaluated, the asthma scores, how bad they were, how good they were. And then also the horses were discharged from the hospital at the end of that 3-week period, and they were reassessed over about a year. And so that's an unusual aspect of this study, to look at what happens in the long term, because it's not uncommon for us or for veterinarians in the field to see horses that have heaves and then treat them with a course of corticosteroids, and they get better, and the corticosteroids are decreased over time. The horses get better, and they're probably fine until the next fall or winter season, when they re-inhale moldy air, and then they get worse. And so the long-term outcome is always a little hard to assess, and that was a strength of this study. And the stem cell therapy proved to have better outcome in the long term than corticosteroid treatment.
Who funded this study, and will there be future studies for stem cell therapy applications to potentially treat equine asthma?
The study was funded by the Slovenian Research Agency Fund to my colleague and his collaborators, stem cell people who grow stem cells. And my involvement was in design of the study and in interpretation, and I did the bronchoalveolar lavage fluid analysis and also contributed to statistical analysis. And yes, additional studies are planned in this with stem cells.
Is there anything you'd like to sum up or mention in closing?
Stem cell therapy is a proof of concept at this point. This is not widely available, and we don't want to mislead people listening to this podcast that this is a commonly available therapy. We're a long way from that, but horses may get there before humans do.